Hi there, my name's Mark and I'm a children's A&E doctor.
Hi, I'm Pauline and I'm a clinical research nurse.
The reason for showing you this video today is so that we can tell you something about amoxicillin, which is an antibiotic that we're going to use to treat your child's pneumonia.
Pneumonia is just a posh word for chest infection, which means that you've got some germs in your chest, and amoxicillin is really good at getting rid of these germs.
Now, amoxicillin's a great drug. It gets rid of those germs really nicely. But like every other drug, it can have some side effects. And with amoxicillin, the sort of things that we think about are whether we might breed resistance in the germs there, or sometimes it can affect the friendly bacteria that are in your gut and give you some diarrhea.
So what he means is amoxicillin is sometimes too good at getting rid of some bacteria.
That's it exactly. So with antibiotics like amoxicillin, we only ever want to use the smallest amount we can to make your child better. That's what we know about amoxicillin, but there's some things that we're not quite so sure about.
So basically, doctors don't know everything, even if it sounds like they do.
One of the things we need to know more about is what is the right dose of amoxicillin to give to a child with pneumonia. And one of the other main things that we need to find out is how long to give it for. So we know in adults that 3 days of amoxicillin is enough if they have pneumonia. But in kids, some doctors give it for 5 days or even 7 days, and we really don't know what the right answer is. Doctors also use a range of doses for amoxicillin, from the lower end right up to the higher end, and some in between. And again, we don't know what the right dose is yet, even though we know that children get better the vast majority of the time when they get the amoxicillin.
So if we could give 3 days of amoxicillin, that could mean taking less medicine with fewer side effects.
But the problem there is that we don't know what the right answer is yet because there hasn't been a clinical trial.
Which is why we're here.
That's right. We're now doing a clinical trial called CAPIT to try and answer some of those questions. We're going to figure out what the right dose of amoxicillin is, and we're going to figure out how long children should take amoxicillin for when they have pneumonia. And we'd like to invite you and your child to take part.
If you do decide to take part, it is completely voluntary. And if you decide not to take part, your child will be treated in the normal way.
So what is a clinical trial? Well, a clinical trial is something we do whenever we're trying to figure out what the best medicine might be, what the best dose might be, or what the best treatment might be. In this case, we're doing it for pneumonia, and we're recruiting over 2,000 children to take part in this study to answer the questions about the dose and duration of amoxicillin in pneumonia.
So how do we do that?
Well, half the children will get amoxicillin for 3 days, and the other half will get amoxicillin for 7 days. And in those two groups, half the children in each group will get amoxicillin at the lower end of the dose range and half at the higher end. And when we compare those four groups together, that will help us know what is the right way to treat pneumonia in children.
So you might think it seems obvious that you'll know which group you'll be in if you get 3 days or 7 days, but we've got a clever trick up our sleeves to disguise this.
That's right. In this study, we'll be using something called a placebo. Now, for the first 3 days, all the children will get amoxicillin. But after those 3 days, half the children will get amoxicillin and half the children will get a placebo. Now, a placebo is an inactive substance. It doesn't do anything, but it looks, it smells, it tastes the same as the amoxicillin. And so it means that we won't know, and you won't know, and your child won't know whether they're getting antibiotic or whether they're getting placebo.
But what if giving 3 days of amoxicillin is not as good as giving 7 days and the child starts to get sick again?
Well, we're not expecting that to happen, but we will be in touch frequently throughout the study period. And what we'll do then is we'll check up to see how things are going to make sure that your child's okay. Because if they're not, we can organise for them to be seen again, and we can organise for them to have more antibiotics.
So we can still cure them?
Absolutely. And while we don't expect it to happen, if we find that a number of them do get sicker after 3 days, then we would stop the study because that would be an answer in itself.
In order for us to see what's happening with the bacteria, we need to take some tests, such as a nasal swab. So we gently insert this into the nose and take a small sample before you start your amoxicillin and at the very end of the study.
And we'd also like to ask you to fill in a diary that we want you to keep every day for the first 15 days. Now, it sounds like a lot of work, but it only takes 5 minutes, and we'll go through it with you before you go home to show you exactly how to fill it in.
So that's it. Don't forget, participation is completely voluntary, and if you have any questions, don't hesitate to get in touch with one of the staff looking after you.